am Sean LeNoue, Dr. Sean LeNoue, and I am a child and adolescent psychiatrist and addiction psychiatrist here with Rogers Behavioral Health. And really looking forward to having this discussion today. And I'm really thankful to have Dr. Etwaroo here joining us today as we talk about some pretty important things related to addiction and addiction treatment. So I'll turn it over to Dr. Etwaroo here in a moment and allow her to introduce herself, and then we'll get started. Please.
Hi, yes, I am Dr. Etwaroo. I'm a board certified general and addiction psychiatrist that works out of Tampa, Florida, and treating adults and adolescents. And me and Dr. LeNoue both feel, addiction, the importance of addiction now, it's everywhere. It's important for us to recognize that it can feel really scary, like life is out of control. And addiction science is working hard to prevent the use and improve treatments and to help people stay in recovery. And a lack of education regarding the reality of today's substance user is fueling stigmatism. Until you know what it means to be struggling with addiction or you go through it with someone else close to you who is addicted, it's hard to see addicts as people. And talking about experiences with those who have experienced addiction or those who haven't can be one of the most powerful ways to break down stigma.
I totally agree with you, Dr. Etwaroo, and I think that part of the work that we do here at Rogers, but it's certainly not limited just to Rogers, in doing this work in the field of mental health and certainly substance addiction treatment. Yes, I think it really is very much about breaking down those walls and barriers, as you mentioned, and really trying to talk about difficult things and difficult conversations and reducing stigma, because the reality, just as you mentioned, Dr. Etwaroo, these are people that we're talking about here first and foremost. And, I think it's fair to say that with very few exceptions, almost anyone and everyone is affected in some way, shape, or form by addiction, right? Because these issues don't exist in silos, and almost everyone knows, has a close family member or a friend or a colleague who may have been or is currently struggling with addiction. And the reality is that when individuals struggle with these issues, really it really through no fault of their own, it really impacts communities, right? And so communities are affected and impacted. And so, one of the things that we'll definitely want to touch base on today is the role of stigma and the way that stigma can really perpetuate mental health and substance use addiction issues. And then, we'll want to talk about that, but then we'll also want to talk about, well, what can we do about all this, right? And so, yeah, I'm looking forward to having this discussion about providing hopefully some hope and some realistic strategies and approaches to, if you yourself are struggling with addiction, anyone out there, or if you know someone who is, we want to help create a conversation because that's how the process of change and recovery can begin. So, I can just give a little bit of my background before we jump in further and just say, so I'm a child and adolescent psychiatrist, as I mentioned, and I'm a board certified addiction psychiatrist too. And so development is really important to me. And I know that Dr. Etwaroo and I both are thinking about, treating individuals and families in the here and now. But I think it's pretty safe to say that it's definitely on our minds too, that we're thinking about, well, where do these issues, where do they begin, and how do they evolve over time? Because rarely, if ever, do we find someone who just one day just tries, injection, heroin or fentanyl. It typically starts and has sort of roots and origins in other areas, whether it's adverse childhood events or experiences, or a lot of stress or anxiety or other things that then can manifest into maybe substance dabbling, substance use, curiosity, and then also maybe a means to sort of self-medicate if there's a lot of things going on in someone's life. And so I think that's really important that we acknowledge too, that that oftentimes these issues are, really a progression over time. And so that's also an opportunity too. Yeah, what your thoughts there, Dr. Etwaroo?
Yeah, and that goes along with, addiction is a developmental disease. Most experimentation occurs in teenagers, and the loss of control in drug intake commonly occurs in late adolescent. The brain isn't fully formed until the late 20s. And, oh, hi, Katie. And so, yeah, one of the last areas to form is the frontal cortex, as we know, and that includes the orbitofrontal cortex, controlling emotions, desires. And we know that the brain isn't fully formed until 22, 23, 24, and that's your daring age. If you're in an environment and culture where drugs are easily available, you're much more likely to try it out. And that adolescent brain has much more plasticity than an adult. So we learn from new connections, and then it just strengthens. And this just brings up what you were saying, prevention interventions early in life that we're both trying to work on. So I will let Katie take back over.
Thank you so much, and thank you for rolling with the surprises of virtual live events. So thank you so much. It sounds like you're off to a great start in your conversation.
We were really just, here for introductions and kind of beginning to segue into some of the questions and discussion points. But yeah, it's the world that we live in, right? So we just roll with it. Yeah.
Yeah. Resilience, as they say, right? All right, so let's get started on a few of the topics we were planning on discussing today. Dr. Etwaroo, to get us started, can you define for us what addiction is?
Yeah, so addiction is a disease of the brain. Contrary to what has been believed for many years, that people take drugs and they can't control themselves because they have poor self-control or a weakened moral character. All drugs are taken in excess. They have a common activation in the brain reward system, which is involved in reinforcement behaviors and production of memories. They produce intense activation of the reward system, increasing dopamine, and then normal activities are neglected. Addiction occurs after repeated use of substances, causing changes in this and making impulses that make you think, make decisions, control actions less strong. And this leads to the state where you're just no longer, you can regulate desire. When a person takes a drug for a purpose that's not intended to, for example, you have an opioid script, and instead of taking it for pain, you start taking it to get a high. This is a state of when you transition from having control on what you want to take the drug to the state where you're no longer, you can't regulate the intense desire without having control, and then you just end up taking the drug compulsively. So people addicted to drugs are taking drugs not because they want to take it, but because they no longer can stop it.
Yeah, I think that's such an important point that you made there too, Dr. Etwaroo, because if I heard you, this is a neurobiologically based illness, right? Just as you said, and so this is while there may be choice along the way as far as kind of doing things that could be protective or maybe not so protective. To work on recovery or safe choices or not falling further into the throes of an addiction, we'll say. It's, I think to your point, it's not as clear cut and simple of just making the choice to use or to not use, that there is hard wiring, we know, in the brain, that some people are just more predisposed, if you will, or more at risk for using. And I guess lastly, I would just comment and say, to your point too, addiction exists, in pathways in our brain that we all have, right? Like the dopamine system is something that all humans have, and that process of reward is actually a good thing, right? But it's when that system becomes dysregulated, or there are other factors that could be coming into play genetically, environmentally, oftentimes out of people's control. That's where we can see that system is hijacked, if you will, and that's where we can see the really devastating effects of addiction coming into play. Yeah.
It's so interesting to hear, that science and biology behind it. I feel like addiction in particular has such a stigma associated with it, with a lot of that blame and judgment. So hearing the facts and the science behind it as a brain disorder is just extremely eye-opening, I think, for a lot of people.
Totally agree. Yeah, we were chatting a little bit earlier too about, the role that stigma plays into this illness, and that it's really when we're not having conversations about these really important issues that stigma, the seeds of stigma can be planted and then certainly grow. And so, I do think that this is just one opportunity of many to be able to have conversations, and sometimes really tough conversations, but meaningful and hopefully impactful conversations. Because again, like we mentioned earlier, I've actually yet to meet anyone that I've been working with who either directly or indirectly has not in some way been affected by mental health and certainly addiction issues in our communities.
Thank you. Dr. LeNoue, to build off of just some of this information that we're learning about addiction, what are some of the common signs that indicate that somebody might be suffering from an addiction?
Yeah, it can vary. And I can certainly give some specifics and concrete examples here, but I think I would definitely start by saying is that it's variable, and sometimes it's not always obvious. And frankly, it's not always 100% obvious, even to trained professionals who do this work. And I think that's what makes this illness at times so tricky and at times difficult to treat. And not only that, but I promise I'm gonna come back around here. But I think to bring up the point and tie in how stigma can really come into play too. Part of the nature of addiction is, Dr. Etwaroo talked about control earlier, but also in order to retain control or to be able to perpetuate or continue to use substances, or for that addictive process to continue, oftentimes there can be components of deceit or lying or other things that come up. And oftentimes when I'm working, with an individual or families, that is a core theme that'll come up in some form or fashion is, well, they lied to us. They stole in order to use, or whatever it may be. And while that may be true, and I'm certainly not trying to downplay that, I think that when, especially we think about stigma, the thing that we don't always talk about is how at the core of this illness is an illness that's in many ways sort of lying, if you will, to the individual, right? And so, it can be hard to identify at times, to the person themselves, how they may be changing and be influenced in a variety of different ways. So specifically, how would you know if you or possibly a loved one may be struggling with addiction? Well, if it's related to substance, we definitely want to think about how that particular substance works. And so if it's alcohol, for example, versus like a stimulant, that could look differently in the acute effects or the high or intoxication, if you will, as well as when an individual is maybe withdrawing or sort of coming down off of the effects of that. So we'll take alcohol, legal substance, pervasive throughout our society and Western culture. And, how do you draw the line, if you will, between, well, this is sort of like recreational or sort of social use versus it sort of beginning to transition to something more significant? Some of the things that we think about, not only diagnostically, but again, we're thinking about the person. We're thinking about the human, the individual here. I sort of start with, well, I ask someone what they feel like their relationship with alcohol or that substance is and is like, and then from there we'll talk a bit about how much do they typically drink or use when they do, how often, right? And then have there been consequences of use, or frankly even at times consequences of not using? Withdrawal would be one such example. And so we want to think about those factors, and I think those are all really important and critical, especially from a diagnostic perspective. But also the thing that we want to really hone in on, or that I think about a lot with patients and families, is quality of life and functioning, right? Because that in many ways will help us to better understand and get a clearer picture of, well, what are the effects of substance use here? And so, things like not engaging in social activities or with family or friends or work, right? Showing up late, leaving early, being hungover, and just generally not feeling well or able to participate in life. I think that's the thing that is always that I remind myself too, and I talk with patients and families about, is that, the effects of addiction are multifaceted, but what we see is that when people are really struggling with these issues, they're sort of kind of falling away out of life, and they're not engaging in the things that have been really important to them for quite some time. Dr. Etwaroo, I wondered if there's other thoughts that you have there about things that you see and talk about with patients and families.
Yeah, I think what's circling around with all substances is that you lose the capacity to shift. It all depends on, again, proper functioning of the brain. So self-control, it means the ability that each one of us has to make a decision on what we should or what we should not do. And if we're honest, we have all been gave into behaviors that have negative effects. Most times we're rational and we think through this, but in the person that's addicted, it just depends on the functioning of their brain. And what's rewarding is context dependent. Rewards are elastic. So if you engage in a behavior that you can't shift from, you lose capacity to shift the behavior, and it starts affecting occupation, functional, social, all those aspects. And then that goes back to seeing that this person may be suffering from substance use disorder.
Yeah. Yeah, I guess I would say lastly here too, what would it look like day to day? And again, we talked about, not showing up, if you will, in many ways, but also we can see people who are really kind, gentle people who can become violent when they are under the influence of substances, or when they're sort of trying to get by when they're withdrawing, and what this looks like, in real life is, moms and dads who aren't able to care for themselves or their children, brothers and sisters, parents, colleagues, siblings, who, you typically, even when it's gradual, what people will see is certainly starkly at sometimes, and then gradually over time, is just a shift in maybe personality, a shift in engagement, and really shifting away from things that are more pro-social and maybe that have been really important to people. Yeah.
Yeah, that's really great information. And I think it's so interesting what you said, Dr. LeNoue, about even, sometimes being a trained professional in addiction treatment, you may not always recognize the signs because it can be so deceitful, not only to people on the outside, but to also the person that's suffering as well. So that's really eye-opening. Another eye-opening and pretty shocking statistic that I recently saw says that nearly 20 million Americans are currently living with a substance use disorder, and some of those are as young as age 12. Dr. Etwaroo, what are some of the different types of addiction that people are struggling with?
Well, today it can really be anything. We live in a culture that is always searching for more to fill the holes we feel inside. And whether that's filling them with drugs, alcohol, food, it's a constant desire for wanting more of anything that can lead to addiction. People become addicted to anything that allows them to check out from reality. And in today's world, that, again, can be sugar, relationships, technology, social media, self-harm, gambling, even power, anything that can take them temporarily away from themselves. But focusing on different substances that people can be addicted to can be alcohol, one of the worst and hardest addictions to kick, caffeine, marijuana, hallucinogens. Those include PCP, LSD, inhalants, paint thinners, glue, opioid painkillers, codeine, oxy, heroin. There's a growing social acceptability for using prescription painkillers nowadays. Opioid painkillers has risen by 300%, they say. Heroin is at least among the top 5 most addictive drugs in the world. There's sedatives, anxiolytics, such as benzos and sleep aids. There's over 15 different kinds of benzo medications for different medical purposes. But when they're used to self-medicate for anxiety or sleep, it's highly addictive. There's stimulants, cocaine, meth, amphetamines. When taken, they boost energy, mood, confidence. They also help suppress appetite. Methamphetamine crash can bring severe depression and exhaustion. Meth binges can have irreversible long-term effect on both the body and the mind. Cocaine is one of still the worst addictions in America. 1.5 million people continue to suffer from cocaine addiction in the US because cocaine boosts positive mood and energy, and then people start using it in work and then recreationally. Tobacco, it's legal, but it's still a drug. Nicotine elevates a person's mood and heart rate temporarily, and many people use 20 dosages of this drug daily to just get their addiction fix.
Yeah, I agree. And I think, you know, like we've been talking about here and previously, you know, these issues typically don't come up totally out of the blue, right? Like it typically, substance use, which then can evolve to addiction, or other behaviors that can evolve into more of a full-blown addiction. It typically starts with curiosity, and it typically can start, I would say, fairly innocently, you know, and so it, you know, specifically when we think about alcohol, nicotine or tobacco, which are both legal, and then, you know, with marijuana as well, you know, most addictions can start and do start with substance use or curiosity, trying different substances from an earlier age. Because like I mentioned earlier, rarely do we see that someone, you know, is going to jump right into cocaine or, you know, IV methamphetamine or heroin or prescription drugs or substances. It happens, no doubt. But when we look at the vast majority of cases, it typically starts just sort of innocently, if you will, and sort of socially, and then progresses over time, oftentimes for a variety of factors, which I think we're probably going to talk about a little bit more here in a bit. But just wanting to lay that out there too, when we think about why is this such a difficult illness to treat at times? Well, because again, it can be subtle. It starts slowly. But again, what I see there are, you know, on the flip side, a lot of opportunities to be able to intervene in a positive way and to work toward prevention, and certainly to help an individual turn things around in a positive direction. Yeah.
Mm-hmm. Yeah, absolutely. And that was the perfect segue into my next question. And Dr. Etwaroo, I think you were already also alluding to it so nicely when you said, you know, people are looking to fill holes. What are some factors that might make somebody at risk of developing an addiction?
I can start us off there, and certainly, Dr. Etwaroo, any thoughts you have too. What factors that put individuals particularly at risk for an addiction? Well, first of all, genetic. You know, we know that some individuals are going to likely be maybe more predisposed or at risk, if you will, for addiction. And again, that goes back to the neurobiology that we talked about earlier. And so, you know, knowing family history is important. It does not define or dictate by any means. You know, if someone in your family has struggled with addiction, that does not mean that you yourself or others will. But it could put individuals more at risk, potentially, based off of how those reward pathways are sort of hardwired. Stress is a huge contributor and risk factor for addiction, because it is not uncommon, again, that people will maybe use substances or different types of addiction, as Dr. Etwaroo mentioned too, as a way to kind of relieve stress. and in order to cope and to get by. These would be sort of maladaptive, no doubt, coping strategies, but oftentimes, too often, I would say that we see that people will use substances or other addictions in order to cope with the stress of life or things that they may be working through and trying to deal with. Mental health, as well as physical health, are also potential contributors to addiction. I think that's, I'll turn it over here in a second if you have thoughts, Dr. Etwaroo, but I want to really point that out again, that these issues, we'll say addiction kind of at the core, but the reality is that all of these issues are really interconnected and related in some way. Stressors, mental health issues that may be coming into play, physical health and wellness, and then the way that even sleep and diet and exercise and how all of those factors all really coalesce and come together and can be protective factors, but also can be risk factors depending on an individual situation that can make people, potentially more prone or predisposed to struggling with addiction. Other thoughts that you have, Dr. Etwaroo?
Yeah, this kind of just brings up the pandemic, an increase in seeing people struggling with addiction. We've had uncertainty about the virus. People have concerns about family and friends. Disruption of daily life routine has led to increased anxiety, and it's amplified in people with pre-existing psychological issues. Exposure to the pandemic has represented a real physical threat to life, and dealing with potential losses has been so stressful. And this in turn has increased drug, alcohol misuse as a coping mechanism, the economic turmoil that has put people at higher risk to take more drugs. And if you're not taking it, it can push you to just experiment it. It's been challenging for people to try to stay in recovery. I know we've both seen more risk for relapse, overdoses. One of the worst things you can do to a human being is isolate them. We're all social creatures. We love to interact. One of the factors of isolation increases drug taking. And right now with social distancing, there's no social reinforcer. It's just been another challenge people are dealing with that drug use has faced. Specifically opioids. They depress your respiration, right? So you stop breathing. And we have a good treatment, naloxone. So if someone has to administer it for you. So if you're by yourself and you lose consciousness, people may be dying from overdoses that should have been reversed, but isolation has just made it harder. Physical distance has hindered community support. In-person meetings have decreased and stopped things altogether. Online meetings aren't the same, but all these things just wrap into that and how the addiction is affected with these stressors and mental health.
Agreed. I think it's also important to point out here, apropos to the times, unfortunately, in thinking about the way that, individuals and different groups of people, potentially, are oppressed or not treated fairly. Those are also risk factors. Minorities, potentially people of color, different ethnic, cultural backgrounds. By no means am I saying, that one group necessarily, uses substance more per se, but when we think about risk factors, right, and thinking about the risk and being vulnerable, which anyone can be vulnerable to these issues. I think that's the thing too. These aren't issues of the other. It's really an issue of us as a society, as a people, as humans. And so the more that we can embrace one another, the more that we can support one another, the better. But I just want to point that out here too, that, to Dr. Etwaroo's point, during the pandemic, we all have struggled, I imagine, in different ways with coping and adjusting to life under a lot of these restrictions, but also thinking too about people who may be facing a variety of different struggles and have been facing a variety of different struggles over time. Our hearts go out to all and to anyone who is struggling. And also, I would just say, we're here. And the thing is that we can do something to help and make things better. And it starts with talking.
Yeah, that's so powerful, what you both said. I mean, especially this pandemic is such a shared, although we're experiencing it in different ways, it is in many ways a shared human experience, and is opening up conversations like this one to help us all understand what each other is going through better. So love it. Thank you. And so that leads perfectly into what my next question was about. So now that we've understanding some of the signs, symptoms, risk factors, things to watch for about addiction, what are some of the ways that we can prevent addiction?
I can take it if you, otherwise.
Sure.
Yeah. So I think here, one of the best ways to treat is to prevent. And one of the best ways to prevent is to, I think it comes down first and foremost to relationships and trust and, again, caring for one another, having honest and open communication, because again, typically these issues don't just sort of pop up in full bloom, if you will, kind of out of nowhere. They typically kind of start and slowly grow over time. So prevention is key. So then, well, how do we prevent individuals from using, like I mentioned, talking, rapport, trust, those are important, but they within themselves, it's not enough. So then we have to think more broadly, even from a societal perspective. How are we taking care of one another? How are we engaging people to live their best lives and to be able to pursue passions and dreams and things that are really important to them, making sure that people have opportunity, right, in all different forms. And education, I think, is really important. Education not only about mental health, physical health and wellness and well-being and addiction, but also the opportunity to receive a formal education and to be able to pursue a job or career or an area of focus that is meaningful to someone. I think that's important. Community engagement and involvement, whether it's volunteering, whether it's sports or music or any sort of religious affiliation or activity. Again, to Dr. Etwaroo's point, we are social creatures. And I think that, some people may desire and find comfort in being, more or less social than others, and that's okay. But I think that, again, engaging with the community, with family, loved ones, whoever it is, that is going to be, in most cases, one of the most powerful ways to prevent, by engaging and then also being able to recognize signs early and if things are shifting, and then being able to talk about it. Yeah.
Great. Along those lines, if we do know somebody or if we are struggling with addiction, what are some good ways to support and reach out to that person, as you were just talking about? And what are maybe some things that you don't want to do or you should avoid doing?
Yeah. So I'm glad you asked this, because like we were talking about the stigma, right? Substance use disorder and mental health issues face greater stigma. And I think it's important to re-examine how we talk about it, and to those who suffer from them is an important step in overcoming and moralizing what's going on with treatment and compassion to have recovery support in our society. So people struggling with drug addiction are often very sensitive. They're emotional, they're insecure about their situation, especially in the early stages of recovery. So knowing what to say to a friend or a loved one can be challenging. Avoid encouraging someone's use by avoiding statements such as, why can't you just have another drink? Or it's all about balance. Or just don't try to keep up with them by drinking and using. Like Dr. LeNoue said, bonding over alcohol will reinforce the belief that drugs are necessary to socialize, right? So instead, suggest activities that don't include addictive substances, some like going for a hike, grabbing coffee, doing different things. Reinforce the idea that somebody may not need drugs or alcohol to be happy and enjoy life, because the brain has been hijacked to only get dopamine from those substances. And staying away from lecturing, threatening, avoid emotional statements that may only increase the feelings of guilt, compulsion to drink, and not covering up, making excuses for behavior or assuming responsibilities, because taking over another person's responsibility is in turn protecting them from the consequence of the behavior. Avoid arguing with a person when they're using drugs or alcohol. At that point, they can't have a rational conversation. Don't feel guilty or responsible for their behavior, because it's not your fault. One of the biggest goals during recovery from drug addiction is for the person that is addicted to accept responsibility for their behavior and their choices. Consequently, blaming other people is not a part of that solution. There's phrases, once an addict, always an addict. This comment not only causes somebody to feel misunderstood, alienated, hopeless about the future. Instead, speak up, talk, offer your support, include your willingness to go with them and get help, because the earlier the addiction is treated, the better. Always express your concern. Don't wait for it to hit rock bottom. Don't wait. You may then have excuses, denial, anger, and be prepared to respond with specific examples of behavior that has you worried. So not showing up for work, or not going to your kids' football games, or not showing up, just those kind of things. Also, some terms can be misleading, such as getting high, right? Even though the initial drug uses, the drug use produces euphoria, there has been a decreased ability to feel pleasure from drugs, and the addictive person's primary motivation is to temporarily escape the extreme lows caused by the withdrawal. So the newer recommendations is to avoid such those terms like getting high, getting clean. Instead, long-term abstinence, we try to say recovery, and just overcoming addiction, remembering that they need treatment, they need support, and they need new coping skills.
Totally agree. Yeah, when you said the term addict, and that's been around, we know, for quite some time, and it is a frequent label that people struggling with addiction often receive. Oh, they're an addict, and there are so many connotations, overwhelmingly negative, that come along with that. And when I work with individuals, it's not uncommon that when I first meet with them, one of the things that will sort of naturally come up is they'll talk about, oh, I'm an addict. And however one chooses to identify, that is certainly their own. But I think too, when we think about compassionate, open-minded care and support, and that's beyond even treatment, which we'll talk about different models of treatment here in a bit. The term addict is very stigmatizing, and I'm glad that you brought it up, Dr. Etwaroo, because it's very pervasive, as well as the fact that, even someone struggling with addiction, the addiction, I would argue, does not define who they are as a person, as a human being. It may be a focal point. It may be something that they are really struggling with. But just as we wouldn't, say that someone who has diabetes, if they are diabetic, that is all encompassing, and by saying that they are a diabetic, that now therefore we know them in any way, shape, or form, right? Or someone who's a cancer survivor, that in any way puts them in a box, so to speak, and that now we in any way really know them, or know their struggle, or what they've gone through. So I think back to the piece about communication, words have power. And I think, we all have different types of biases. It is innate to being a human being. But I think thinking about our biases, I think thinking about being open-minded is really important, because those who are struggling, they're going to pick up on nuances, and they're going to, at the end of the day, I'll say lastly here, I've yet to meet someone who's struggled or has struggled with addiction that when things progressed, that they really liked where things were at in their life. I mean, there's always, kind of that one-off exception to the rule, but for the most part, these issues sort of come up innocently. They progress sometimes, more gradually or more aggressively over time. And oftentimes what people will say is, I started using a substance or whatever it was because I really enjoyed the high. I was chasing the high. But pretty quickly after that, it really shifted. And the high didn't really do it for me anymore. What I was still running, but instead of chasing the high, I was running away from the withdrawal and the consequences of the substance use. And that, overwhelmingly is the message that I hear from folks over time too. They're like, if I could give this up, I would. And I'm really fighting hard to try to give it up. And if I could never have started in the first place, oh my gosh, what I would give to never have even picked up that first cigarette or that blunt or that joint or, smoking methamphetamine or cocaine. Like I just never would have done it. It wasn't worth it.
Yeah, thank you for that. So you alluded to it in this discussion, but let's get a little bit more into what treatment looks like for addiction, Dr. Etwaroo.
Well, only an alarming 11% of America's struggling population receives treatment, because substance use disorder affects many aspects of a person's life, regardless if it's mild, moderate, or severe. Multiple types of treatments are often required. For most, combination of medication, individual or group therapy is most effective. So the medications prescribed are used to control drug cravings, relieve symptoms of withdrawal, and to prevent relapses. Psychotherapy helps us understand behaviors and motivations, develop higher self-esteem, cope with stress. A specific type of therapy that we use at Rogers, cognitive behavioral therapy, helps you get at the root of the matter, surrounding habits, ways of thinking that can help you alleviate distress. So the first step of treatment is to recognize the problem. We don't know how to completely cure addiction, but we do know how to treat it. And so that, for instance, is like when Dr. LeNoue brought up medical instances. When you have high blood pressure, you give an antihypertensive, right, to control it. When you have an infection, you give an antibiotic to cure it. So again, we don't have a cure, but we are treating it. And so first, the medical professional should conduct a formal assessment of symptoms to identify if a substance use disorder is present, and then assess the level of care. We have hospitalization for medical withdrawal management, detoxes. We have therapeutic communities like highly controlled drug-free environments or sober houses. We have outpatient medication management. We have psychotherapy. We have intensive or partial hospitalization programs, the setting in which me and Dr. LeNoue work in here to treat patients at Rogers. We have residential treatment, which is like rehabs, and many people find mutual aid groups helpful, Alcohol Anonymous, Narcotic Anonymous. We have self-help groups that include family members, Al-Anon. So there are medications for alcoholism and nicotine use disorder, but by far the most effective is for opiate use. The opiate crisis has helped acceptance of medications. There has been even extended release formulations that make it easier for people to take medications. There are one-time month injections to decrease alcohol use. For opiate use disorder, we use Suboxone, Methadone, Naltrexone. We don't have an FDA medication for methamphetamine or marijuana addiction, but we do have behavioral treatment interventions that has been effective, such as contingency management, where we check milestones. We're able to reward the patient for how far they've come. And there has been a recent urgent need in the past year to provide support via telehealth with substance use disorders. Now, with all the changes, importantly, a doctor can prescribe medication that can prevent overdose. It also can, again, inhibit the control of the desire to use it without necessarily having to meet the patient. So in the past year, it's really expanded the number of people that can be treated. And in the end, there's not a single treatment that's going to work for everyone. Our experiences are all unique. Everyone's experience is unique, and we need to tailor the treatment for the patient suffering from the drug. It's a chronic disease, and we have to have continuity of care. There are frequent comorbid mental health disorders because the damage the drug does to, again, the prefrontal cortex has devastating consequences to address stressful situations, making them more vulnerable to mental illness, because otherwise they're going to relapse. Dr. LeNoue, in regards to treatment and opiates and all those things, do you want to weigh in on that?
Yeah, I agree with you. And just a couple things I would say here to really highlight would be, number one, we have robust and effective treatment strategies that work and that are evidence-based and approved. And we're always striving to further refine our strategies and our approaches to be able to help people get even more relief, and that we'll continue fighting this devastating illness until we get to a cure. But until we're at that point, you know, people's lives must go on and should go on, and we want to be here to help and to support. You know, I would just also just add to your point, Dr. Etwaroo. So, you know, these are complex issues that require multifaceted treatment approaches. It's not going to be a one-size-fits-all approach, as you noted. And so I think we've got to think about the person holistically. I think we've got to think about this person just as that, a human being, a person. And so we have to think about their physical, medical health, right? We've got to think about their mental health. We've got to think about, you know, any issues that they're facing with addiction. And we've got to think about how all of those issues sort of function independently and how they affect one another as well. And again, I mentioned earlier, you know, the role of like diet, exercise, and sleep. Those are all really, really important, because if we're really going to work towards overall wellness and health, then we have to treat all of those issues, and we have to treat them concurrently or at the same time. You know, previous philosophy and approach was, well, you know, we can't help you, you know, with your anxiety until you get, you know, the addiction under control, is something we would commonly hear. And while there, you know, I think that makes sense on a certain level, what we know overwhelmingly clinically and from research over the decades is that, you know, one can beget the other. And so someone who's anxious may be using marijuana or opiates or benzodiazepines to self-medicate. And so, you know, and vice versa. And so really we know that when we provide treatment and address all the issues at the same time, that's where people have the best outcomes. And, you know, I'll say lastly here before we move on that, you know, medications, there are certainly evidence-based, FDA approved medications out there, and we need more. And certainly, you know, by that, I don't mean to imply that medications are the answer, but rather that they could be a part of the solution. And any really good, robust treatment plan would likely incorporate the many things that Dr. Etwaroo mentioned. And I think that having a conversation with your provider about if there are safe, effective medications that could help, that's a conversation worth having, because in combination, again, I'm thinking about things in combination of really robust, good psychotherapy treatment, skill building to change behaviors and reinforce those good behaviors, along with medications that could help to further galvanize someone's recovery. That's something that we know to be safe and effective.
Thank you. I see a few questions coming in from viewers, so I'm going to skip over to those now. First up, what can we do to educate people so people can support people suffering from this disease? I don't believe there is enough education on this.
Totally agree. Our website, rogersvh.org, we certainly have resources on there about treatment and about stigma and education. We provide those education services through our treatment programs. But beyond Rogers, right? Like our focus and concern is for individuals and families and communities. So resources, websites, information that are peer-reviewed, validated, I think is really important that you think about where you're getting your information from. There's a variety of different resources. SAMHSA, SAMHSA, is a wonderful website, and that is the Substance Abuse and Mental Health Services Administration through the federal government. They have a variety of different educational resources, treatment resources. NIDA, NIDA, is also a wonderful resource, and that's a part of the umbrella of Health and Human Services, and can provide a lot of great resources, again, that are free on education for both individuals and families. And then, talking to, your providers. That's a really great resource. And I guess lastly, I'll say, we recognize the need for even more resources and education to have these conversations. So we welcome anyone's feedback, and we're also planning to provide more educational sessions too. Yeah.
Thank you. Next question, is there a standard length of time before dopamine starts working again without the drug? Is it dependent on the drug? May it sometimes not return?
So in regards to that, there has been some studies that show that it takes complete abstinence from the drug for the dopamine to regulate back and finding joy in regular, normal day-to-day activities. And this also can go along, again, with the comorbid illnesses that you could be suffering from if it's depression and anxiety, and getting all of them treated together so that you have a professional on board and seeing what is missing and where it's coming from, where the lack of dopamine is coming from too. So there isn't a specific time period. However, there has been studies that's shown a year, 2 years that it has been reversed. But again, everybody is unique. Everybody's experiences are unique, and so there's not a timeline.
I agree. And Dr. Etwaroo is spot on. It does depend on the medication or substance, the amount, the frequency, the duration of the use. But in addition, we not only are thinking about, okay, people who are working toward recovery, however they define that, not only do those systems, the dopamine pathway, for example, does that have to reset? Okay. But also we have to think about from a behavioral modification standpoint, not only do we need to allow that system and systems to reset, but we also need to work on strategies for helping people to find pleasure and to adjust and deal with stress in a way that is safe and effective and doesn't involve substances too. So at the core, we're sort of talking about two parallel processes of not only allowing that system to reset and rejuvenate and recover, but also we're trying to help the individual to learn new strategies for dealing with various aspects of life in a way that doesn't involve substances either. So really quick thing, I said Department of Health and Human Services earlier with NIDA, more specifically that they're under the branch of NIH, or the National Institutes of Health. Yeah.
Thank you. Let's see. Next question, why do some people have a harder time quitting than others in relation to the brain?
Well, the way our brain functions person to person is very different. And I think this kind of goes back to the last question, last answer, where we were tying around when was the drug started. We know that if it's younger, things change more rapidly than when you're an adult. So like I talked about earlier, the plasticity of the brain forming memories towards this drug, it's a conditioned response also. So people, places, things, those kind of things. Dr. LeNoue?
Yeah, I totally agree. And if I heard correctly, Mrs. Apfel, why are certain drugs harder to give up, or why do certain people maybe struggle more with giving or reducing, eliminating substance use? Yeah, I agree with you, Dr. Etwaroo. And I would say, again, like we've talked about, these are complex issues. So then where I go to is, well, what if we're trying to work towards recovery and reducing and eliminating substance use, what are other factors that have improved and or changed in their life? If you've got someone who is, you know, struggling with being the victim of domestic violence, and every day, a partner, whomever comes home, and the individual who is using substances is constantly being assaulted, attacked verbally, physically, sexually. I think it's going to be harder for them to work toward recovery if they're still facing a lot of stressors, like trauma or abuse, as one example. So that not only the substance itself, but also we have to think about what are other factors, protective and maybe non-protective factors, that are changing or not changing in their life that could also be contributing to ongoing substance use. Yeah.
Next question, is there a certain type of addiction that's harder to recover than others?
Well, one of the hardest addictions to kick is none other than alcohol. About 30% of Americans have suffered from alcohol use disorder in the past, and that's close to 100 million people. So I would say that's probably top of the line, but we also do have tobacco and we have marijuana now. Our American society is in a state of ambivalence about marijuana use also.
Yep. The FDA, to that point, is looking as we speak at potentially mandating that different nicotine vape tobacco products reduce nicotine levels below the non-addictive threshold. That won't necessarily do away with these issues and concerns, but certainly could be helpful. But yeah, those are, to Dr. Etwaroo's point, those are highly socially acceptable and pervasive, substances of use. And, when we think about relative risk and harm, while we know that they can be at times deadly, the perceived risk of use, at least individual use, is relatively low, despite the fact that we know that that's not entirely the case. Lastly, I would just add to, when you think about substances like methamphetamine, cocaine, highly addictive substances that we see people can really struggle with full-blown addiction, not being able to give it up after very few periods of use, just because of the potency of these substances and the way that, frankly, that they hijack the dopamine and other systems of the brain, so that pretty quickly people are really, really struggling in a bad way, even from just a little bit of use.
Thank you. And I think we just have time for one more question, and I know that there are a few that we're not going to be able to get to within the time we have today, but we promise we will post responses, and if anything comes up that any viewers think of later, feel free to reach out to us directly via our direct messenger. But to wrap with one more question today, and this might be a more complicated one, but what about gaming addiction and social media use? anyone want to tackle that one?
I can get us started, and I'll be brief in just saying that is a really great and important question. I feel like we could give a whole talk and have a whole discussion just on that alone. It is an emerging area. We know that this has been an issue, but it's a emerging and burgeoning area of research and data that we're collecting. Number one, first and foremost, we know that it impacts and affects these same reward and addictive pathways that substances or gambling can. And so I guess I would say more than anything else, again, it's tricky because, again, these issues are social media. It's pervasive. It's not going anywhere. I don't know that we would necessarily want it to go away entirely, but the way that it can, again, hijack people's lives and brains and affect functioning, well, there's definitely some room for improvement there. So continuing the conversation, and I'd say in a nutshell, it's probably going to start with balance, and it's more complicated than that, but at least starting there.
All right, thank you so much. And I know we have several questions we didn't get to, so I apologize. But as I said, we promise to respond to each and every one of them. But that is all the time we have for today. Thank you so much for joining us and for sending your questions and for hanging with us with the technology snafus of today. But we hope this was helpful for all of you to learn more about the signs, symptoms, and treatment of addiction. Thank you, Dr. Etwaroo and Dr. LeNoue, for your time and your expertise. Just a reminder that for more information on mental health and addiction treatment and other resources, please visit our Rogers website at rogersbh.org. There's a ton of helpful blogs, videos, resources, podcasts, and information about treatment. So please reach out if you are struggling. Thank you again, and have a wonderful afternoon. Stay well.
Thanks, everyone.
Thanks.